Hi everyone, it's Dr. Mazar from Men's Medical Clinic based in Leeds and across the UK. So today we're going to talk about side effects of TRT and hopefully introduce some issues that can happen with TRT, things we look for and monitor and assess, and how we manage these side effects. So this is going to be a whistle-stop tour in terms of common things that we need to monitor on TRT. Now, obviously, with TRT, testosterone replacement therapy, we are providing exogenous testosterone into the body to alleviate symptoms that the patient is having. So this could be low mood, it could be fatigue, it could be low energy levels, erectile dysfunction, brain fog, hot flushes. So there can be a variety of different symptoms. Now, with TRT, we know that many results an improvement in their symptoms and quality of life. So when the energy goes up, the sex drive goes up, their mood improves, that often bleeds into different aspects of their life, into better relationships, into better performance at work, more energy to play with young kids, for example. So all of these factors can go towards improving the quality of life. However, it's important that every patient is aware of some of the common side effects of TRT and what to look out for before you make a decision. So this way you can make what we call in medical terms an informed decision. So you can only make an informed decision when you know both the pros of the therapy and the cons, so the positives and negatives as well. So starting off, so we're going to talk about number one, the suppression of your hormonal axis when you're on TRT. So when we introduce exogenous testosterone into the body, the hypothalamus and the pituitary gland in the brain sense that there's enough testosterone in the body, and they downregulate or suppress luteinizing hormone LH and follicle stimulating hormone FSH. When these hormones become downregulated, there's less signals going to the testicles, and the testicles themselves can shut down. This is a normal suppression that you get with TRT. Now, it's a suppression, not a destruction of the hormonal axes. So whilst you're on TRT, your natural system will be suppressed. Once you come off it, the natural system should kick in. Now, if you've been on TRT for a couple of weeks or a couple of months, the natural hormone production will kick in quite quickly, usually within a couple of weeks. However, if you're taking massive doses, which you probably wouldn't if you're on TRT, so that's more for sort of bodybuilding community, or been taking TRT for many, many years, so let's say 10 years, for example, it will take a lot longer for your natural production to kick back in. So it could take up to 12 months, it could even take up to 2 years. So the suppression is dose dependent and also dependent on how long you've been on TRT. Now, number two, related to that, is testicular atrophy. So most men will experience about 20 to 50% reduction in the size of the testicles, sometimes even more. Now, I used to say to patients, generally this is a cosmetic concern, so it's based on you and your partner and if it bothers you. And often for many men it doesn't. However, there's a small proportion of men who, when the testicles are shrinking, they do get some aching discomfort pain with it. The other thing that can happen is if the testicles shrink to a significant amount, some men, when they're having sex, the testicles can withdraw inside the body, and this can cause discomfort and make sex unpleasant. So generally, yes, it's a cosmetic concern, but in a proportion of men, it can be a medical issue as well. Obviously, we can use HCG to stimulate intratesticular testosterone production and maintain the testicle size in men who find that important. Number three, we're going to talk about infertility. So after taking TRT just by itself, over 90% of men will become azoospermic. So what that means is sperm can become undetectable in their semen. Now, once you stop TRT, the sperm production should start back up in most men. However, I always recommend to men to get a baseline semen sample done before starting TRT to see where you're at, because you could be infertile for other reasons without being on TRT. So it's important to know what your starting point is. Now, the other thing I recommend to a lot of men is sperm banking or sperm freezing. So this is a service available privately in the UK and there is a cost associated with it. However, if fertility is really important for you in the future, it's one of the safest options that you can do. The third thing you'll see a lot on forums and YouTube and social media is HCG. So HCG mimics the luteinizing hormone and therefore stimulates the testicles to keep producing testosterone. Now, it's a common myth, but they do not stimulate spermatogenesis directly. However, they maintain a good testicular environment for sperm production to continue, and in many men, they will get a continued sperm production. However, it may not be as good as it was before, and it doesn't guarantee in every man as his spermia is not going to happen. So that's infertility. So number 4, we're going to talk about haematocrit. So haematocrit is how much of the blood is proportionally is made up of red cells, red blood cells. So TRT stimulates erythropoiesis, so the stimulation of hemoglobin, which then allows oxygen delivery to tissues. It's part and parcel of why you feel better and more energetic on TRT, because you've got more oxygen delivery going to the tissues because of more red cells and higher hematocrit. Now, one of the issues you can get is the hematocrit can go too high, and potentially this could be a factor in blood clots or heart attacks. Now, the evidence for that is controversial, and I'm not going to go into it too much today, but if the hematocrit reaches 54% plus, you don't need to panic and stop TRT, but you need to review this and change something. Now, that could be lowering the dose of TRT, that could be increasing the frequency of TRT, that could be switching to an alternative form, such as going from injections to gels, or going from cypionate to libido, or microdosing, for example. But it's important to take a holistic approach as well, so looking at things like smoking, looking at risk factors for sleep apnea, looking at lifestyle factors such as cardiovascular exercise, obesity, hydration status. All of these can play an impact on hematocrit. So number 4, we're going to talk about estradiol or aromatization. So when you're on TRT, a proportion of testosterone is converted into estrogen or estradiol. Now, if the levels go too high, you can get side effects such as mood fluctuations, acne, oily skin, gynecomastia, nipple pain or sensitivity. Now, it's unusual that it reaches that level, but your blood tests need to be monitored. And if you do develop these symptoms on TRT, you need to discuss that with your doctor. Now, once again, if this happens, there can be various reasons, such as age, such as genetics, such as obesity, such as your alcohol intake. So all of these factors need to be controlled first. However, if you are aromatizing a lot, you need to look at the dose of TRT, the frequency of it, and in a minority of cases, look at something like a aromatase inhibitor. So these are medications such as anastrozole or exemestane, which reduce conversion of testosterone into estradiol by inhibiting the aromatase enzyme. However, they do have side effects long term, such as poor lipid profile and joint pains. So it's usually a good idea to be on the minimum effective dose for the shortest period of time if possible. The other issues I want to talk about are cardiovascular complications. So that's number 5. Now, this isn't something that I'm overly worried about with TRT, but it always needs to be discussed with patients. So the Traverse trials were a big USA study on over 5,000 patients who were aged between 45 and 80 years old who were on TRT or not on TRT. And they compared the cardiovascular issues that arose in that study over a period of years to look if there was any difference between the control group and TRT group. They found that there was no difference. So we know TRT does not increase the rate of cardiovascular complications compared to control group. However, the study was only over a number of 2 to 3 years. So I always say to patients, it's good to check your general cardiovascular risk factors. So we always monitor the patient's blood pressure, their weight, their body fat, their hematocrit, for example, and we look at other things such as cardiovascular exercise, smoking, diet and general lifestyle issues as well. So all of these need to be controlled to manage the cardiovascular risk. Now, can you be on TRT and develop a heart attack? Absolutely, yes, you can. However, the chances are you probably would have had that heart attack anyway. So these factors need to be considered and discussed with the patient. Number 6, we want to talk briefly about prostate issues, and the same trial, TRAVERSE trial, also looked at incidence of prostate cancer and whether TRT causes prostate cancer or not. What they found was TRT does not cause prostate cancer as far as we know. Now, sometimes it can unearth prostate cancer, so if the prostate blood test PSA is rising up and up and up, then you need evaluation via a urologist. So it's always good to check the PSA regularly on treatment, potentially do a digital rectal examination for patients at baseline, and once again, refer to a urologist if you are worried about prostate cancer. I hope this has given you a good nutshell and whistle-stop tour in terms of some of the side effects of TRT, what to look out for, how we manage it, and also to give you the information that you need to see if TRT is the correct treatment for you. If you have any questions, you can contact me on info@mensmedicalclinic.co.uk or check out our website www.mensmedicalclinic.co.uk. We're based in Leeds, where we have face-to-face clinics, but we also offer clinics online across the UK, and we've got patients 4, 5, 6 hours away from us. If you have any questions, feel free to contact me. Have a great day.